think we really do believe an e-health revolution is taking place. I think there are a number of factors which point to that. I think the availability of health-related data and the amount of health-related data that we're likely to see going forwards is going to increase by about 50-fold, we think. There are information coming from a whole range of new kind of devices. We see Apple recently launching their health kit, we see Apple launching their iWatch. These health and well-being devices are going to become more and more prevalent, which gives us more and more information we need to start collating. Genetics data, so the cost of sequencing a genome is now reducing to such a point that it becomes economically viable to do it for a greater range of our population. So bringing all that information together will allow us to be much more predictive in the way we start to deliver healthcare going forward. To be able to manage that level of data is challenging, because in a traditional sense, if a doctor looks at a set of case notes, there's a small amount of information in there. Now we're trying to provide them with a much greater array of data. So the systems that provide that data need to be intelligent. They just can't provide that en masse. They need to provide clinical intelligence and clinical knowledge to that information to be able to provide the right and the most pertinent information to those clinicians to make choices that affect people's lives positively. Orion has a wide range of solutions to address this. So we have an open data platform and an extensible data platform that is growing, that allows us to consume any kind of data, any kind of information, no matter where that data may come from, but store that in a raw data format, as well as storing it in a structured format, which means we're future-proofing that data, so we can replay that information for different reasons, even though it might have happened 2, 3, 4 years ago. We provide a platform to view and manage that data. We provide intelligence solutions to apply that level of intelligence, that data, to present the most pertinent data to clinicians. And then we provide workflow and clinical documentation solutions to manage process and manage workflow that's driven by and influenced by that wealth of data that's coming to us. And then finally, we provide access for patients into that information so that they can take a greater responsibility for their own healthcare and have a greater access to what's going on within their own health environment.